Treatment options for patients with recurrent metastatic head and neck cancer who have failed platinum, EGFR targeted therapy, and taxanes are limited. The authors included 31 patients in this study. All patients had received at least 2 prior regimens for recurrent and or metastatic disease, and some of them had even received 5 treatment regimens. Their statistical hypothesis was to attain lack of progression in at least 6 patients. This statistical goal was accomplished. However, their conclusion cannot be justified by these results. The patients suffered substantial toxicity. Therefore, these patients had very short survival with substantial toxicity. And we cannot conclude from this study that cabazitaxel deserves further exploration in head and neck cancer. Of course, it's a very difficult setting because patients were heavily pretreated, and it is challenging to show an activity of a drug in this difficult patient population. New drugs should be tested in chemo-naive patients in order to show their potential. The majority of nasopharyngeal carcinomas express PD-L1, and PD-L1 overexpression has been linked to poor survival. Therefore, targeting PD-1 checkpoint appears a reasonable therapeutic strategy in nasopharyngeal carcinoma. Pembrolizumab is a highly selective, humanized anti-PD-1 antibody which blocks the interaction of PD-1 with its ligands PD-L1 and PD-L2. 27 patients were enrolled in this study. The patients had either unresectable or a metastatic nasopharyngeal carcinoma, and many of them had received at least 1 prior chemotherapy regimen. The overall response rate was 25%. Patients received this treatment until progression of disease or unacceptable toxicity, and received pembrolizumab for up to 2 years. Some of these patients, at the time this abstract was written, were still on pembrolizumab therapy. The treatment was well tolerated. Grade 3 and 4 adverse events were occurred in about 22% of the patients. The main drug-related adverse events were maculopapular rash, hypothyroidism, and pneumonitis. From this data, we can conclude that pembrolizumab is an active drug in nasopharyngeal carcinoma and deserves further evaluation in this disease setting. As expected, HPV P16 positive patients had significantly better outcome compared to stage-matched HPV negative counterparts. In terms of global health status, HPV positive patients started from a higher quality of life score compared to P16 negative. However, P16 positive patients experienced a rapid decline in the quality of life score following the acute phase of treatment. However, they recovered at a higher level compared to HPV negative. In addition, HPV positive patients had swallowing difficulties, and they experienced residual dysphagia which lasted 2 years after completion of treatment. From this data, we can conclude that HPV positive patients experience toxicity from chemoradiotherapy. We know that HPV positive patients are younger and expected to live long. These patients have better outcome compared to HPV negative patients, and they are going to suffer the toxicity of unnecessary overtreatment.